Thanks, Gordon, and thanks to Jill and the Pork Board for the opportunity to be here. This is actually my second talk this morning on antibiotic resistance. Down the road in St. Paul today, there's a meeting that's called the One Health Partnership on Antibiotic Resistance and Stewardship for Minnesota, and so introducing it with the Commissioner for Health, the Commissioner for Agriculture, and the Commissioner of the Pollution Control Agency. So there's a room full of about 70 people up there who, over the course of the day, are going to be talking through what is supposedly things that could be done in all these different sectors to tackle this problem. So as Gordon said, I'm involved in the Presidential Advisory Council. I'm also on sabbatical from the University of Minnesota at the moment and working in the NPPC office in DC, and most of my time during that period is on various aspects to do with this issue of antibiotic use and resistance. So I'll maybe give a few comments of bigger picture issues that are going on and leave Paul and Laura as the experts on what it's going to mean to most of the people in this room. The global crisis language, I go to a lot of meetings on this at the moment, and everyone will somewhat at some point stand up and say this is a crisis, this is an emergency, and largely coming from the human medical side. People in infectious disease, doctors who are treating people in hospitals and are seeing this going on. So this is just a slide I pulled with projected deaths for 2050, annual deaths, looking at very large numbers. You know, like all these projections, are they true, are they real, will they come to pass or not? Doesn't really matter, but there's just lots of them out there and they're driving the conversation. So this issue of this being perceived as a major public health concern is being echoed all around the world, and particularly coming from the medical infectious disease side, which always leaves the question of, you know, what are we doing, how much are we contributing? We could spend the whole week arguing about that. So, but the issue is that pretty much all groups are saying we have to do things properly everywhere, and we're part of everywhere, and so we need to at least be engaged to have, I think, a little bit more control and input to these discussions. So I'll be leaving here as soon as I'm done and going back to sit around the brainstorming session with, and there are a number of food animal involved people that are in that process there, but it's, again, an important thing for most of us, particularly on the veterinary side, and there's a lot of you in the room, to try and make sure collectively we're at the table for all these conversations. So these are the things that you're hearing. Antibiotics truly are miracle drugs. The efficacy is declining. Modern medicine is dependent on antibiotic use. And so a lot of the issues that we're seeing the medical people talking about, transplant patients, immunosuppressed people, so suppressed people, so age pages, but particularly the heroic medicine, if we call it, particularly in older populations. So people, and I'm getting there now, with parts being replaced, knees, hips, all those things, where there's a high risk of infection, and they're the groups that are really feeling the brunt of this antimicrobial resistant problem. So one of the things in agriculture, most of the time we treat relatively young or very young and relatively healthy individuals. Most of what's going on in the medical community, most of their antibiotic use is going into patients that are medically compromised, in some cases extremely medically compromised, and so they face a lot of difficult outcomes. So the point I want to make here is when we say modern medicine is dependent on antibiotic use, people say, well, these things are great. I've got a really good friend whose life extended by a transplant. Wonderful outcome, wonderful event. Most of you in the room probably have family members or friends who've benefited from modern medicine. Modern agriculture is dependent on antibiotic use in the same way as modern medicine. These products have been developed, they've been available, we've found ways to use them, we've found ways to use them to optimise animal health, food safety, the whole efficiency of our systems. The problem is that the agricultural side, using them strategically, using them well, using for a better product, is turned into a condemnation rather than a commendatory. So we've got both of these sectors have used these drugs in the manner that they want to use them and make them effective. But people, I guess it's a priority thing. They say all dependent uses in medicine are a wonderful thing, and all uses in animals are maybe less important, less easier to critique and put some pressure on. The other things I'll say, we know, or I know, or I think antibiotic use leads to resistance in any setting, okay? Human, animal, environmental. We can't argue that we make no contribution. The contribution of antibiotic use in the food-animal situation is greater than zero. Simply with our foodborne pathogens, Salmonella, Campylobacter, we know those agents are transmitted by food. We know that there's more resistance actually in Salmonella in food-animal populations than in the human client base, but it's not a zero thing. It might be particularly small, and I happen to believe it's particularly small, but it's not zero. One of the things is that because other people in other places do things worse, that might be an argument we don't have to change our practices. So very commonly you hear there's no regulations of antibiotic uses in China, in India, all through Latin America, in humans or animals. You can walk in off the street and get what you like. And that's true, and that's a problem. And as I made the point down the road there, we could be just rearranging the deck chairs here in the developed countries if that's not being addressed. And it needs to be addressed. But the fact that that's true isn't an argument for what we will call injudicious use in the food animal or the medical sector in developed countries. We need to make sure we're doing things to the best practices possible, and just because someone's doing something worse shouldn't let you off the hook ethically. Lack of proof of harm is not an argument for injudicious use. Growth promoters, as Paul pointed out, are going away. They've been freely available for 50 years in this country. We didn't lose those because of proof of harm. We lost them because it hasn't been philosophically defensible in the current society to say, okay, we're going to use these antibiotics to make pigs grow faster, when there's people pointing at the fact that, you know, we have a growing problem here, your sector contributes to it. So we have this thing that proof of harm is one issue, and can we philosophically defend these practices or not? Just a word on the National Action Plan to combat antibiotic-resistant bacteria. So there is a national plan. The advisory council that I'm on is really monitoring the progress of the federal government agencies in implementing the plan. We're not coming up with a plan. These are two goals from that plan. One, slow the development of resistant bacteria to prevent the spread. Sounds like a good thing. The second one, strengthen national One Health, meaning throwing animals, veterinary, the environment, medical health all in together. Surveillance efforts, and that means measuring resistance and measuring use, putting them together. So if we put them down to one word, this word stewardship, you will hear a lot. This is basically developing processes to use antibiotics most efficiently, most effectively, doing it the right way. The second word is surveillance, which means measurement. It's the if you don't measure it, you can't manage it argument. So there's a lot of initiatives at the moment to upgrade the measurement of resistance and the measurement of antibiotic use in both the animal and in the human sector. What button am I pressing here? I'll go for this one. And really they go in together. Okay. Initiatives, and this is one of the questions listed for the day, the need to measure antibiotic use in animals. Currently, we have sales data nationally that come in for a lot of abuse and a lot of criticism because they're not very refined. We can't tell what's in cattle versus pigs versus companion animals or aquaculture for a lot of products. The national plan is calling for more measurement of, more refined measurement of antibiotic use in food animals. The government agencies, particularly the FDA, looking to the USDA, are trying to measure the impact of the changes that are happening that Paul and Laura have spoken about. How do we know they've worked? If we're not measuring it, we can't figure that out. There's lots of endless numbers of, as again Paul noted, consumer groups, politicians that saying we need to tighten the screws on these guys. We don't like them, we don't like what we think they're doing, even if we don't understand it, but pressure's coming from that source. A lot of things happening in Europe, including a directive that's now going to the World Health Organization that we need to find consistent ways of measuring antibiotic use in food animals internationally. That means benchmarking, that means finger pointing to industries that are higher users. In some countries, they already have systems that are measuring antibiotic use comprehensively in the industries and down to the level of the individual producer, individual veterinarian, for purposes of benchmarking and in some cases regulatory intervention. We're hoping we don't end up at that point, and I don't think we will for a long time, but those models that exist and they influence the discussion. And the other thing that you're all aware of, more and more customer demands for assurances relating to the fact that antibiotics are being used properly, both internally, nationally from retailer groups, but also from the international marketplace. So a lot going on there. How am I doing for time, Gordon?
You finish up.
Okay, finish up. The last thing I'll just put up is this idea of defensibility. So I've got production uses, growth rate, and on the left, going through to, as Paul pointed out, preventive uses, control uses, individual treatment. On the right-hand side there, we're not going to see much pressure there on availability and what we do. On the left-hand side, the production uses are essentially gone, except for 5 products that are still there. A lot of pressure coming on routine preventive uses, and we're going to have to make sure we're in a position to defend the practices we have preventively as justified to be able to basically hold our ground on that. Okay, I'll stop there. Well, the last point really is who gets to decide what is inappropriate, and I made this point up the road this morning. Our industry has got a good record on stewardship. Paul pointed out, particularly with the reduction in residues. One of the issues is should industries and veterinarians be left to more or less self-regulate? I think we're going to need, and we're starting to see it in Europe now, a lot more research on how antibiotics are used, how that interacts with the resistance, because that's going to be needed to really defend our necessary practices to make sure we're producing healthy animals and safe food. So I'll stop there.